What are your options for dealing with joint and muscle pain? I've heard this problem described as the supermarket effect. Imagine going to the chip aisle of a large grocery store. Which chips do you buy? And how do you make the right choice? The chips at eye level are being strategically presented to you by the supermarket. These are the first chips you will see, and you are most likely to select from these options. As you look around, you may notice some other chips are labeled as all natural and organic. Is that a better choice? Some chips are significantly cheaper and even on sale. Do you make a choice based on price alone? Then you see the brand of chips that your friend recommended. She had a good experience with those chips. Is that the right choice for you? Maybe you don't even need chips. Maybe crackers would suit you better. Or how about a mixed bag that contains multiple types of crunchy treats that are both salty and sweet? This is literally what goes through my mind when my wife just writes chips on the shopping list. Dealing with pain presents a similar dilemma. How do you select the best option or options for you? Here are some choices that may or may not be at eye level. Soft tissue therapies, for example, massage, cupping, scraping, dry needling, and kinesio tape. Joint manipulations, for example, getting your back cracked by a chiropractor, or mobilizations without a thrust or a crack. Modalities, for example, e-stim, laser, and ultrasound. Shockwave and TENS units. Supplements, for example, glucosamine, collagen, and herbal supplements. Medical treatments, for example, pain medication, anti-inflammatories, injections, or surgery. Physical activity and exercise, for example, walking, moderate or vigorous cardio, strength training, yoga, Pilates, stretching, or rehab. Another option is simply to do nothing. Just walk away from the chip aisle completely. The interesting thing is that none of these options clearly outperform any of the others in research or in clinical practice. You could find literature to support and refute all of them, both peer-reviewed and anecdotal case studies. Unfortunately, clinical practice is even more confusing than the literature. If you are in pain and you see a specialist, what do you think that specialist is likely to recommend? For example, if you suffer from back pain and you go to a traditional chiropractic office, it is very likely that they will recommend a chiropractic adjustment. If you see a massage therapist for the same case of back pain, they will probably recommend a massage. A shoe store will probably recommend new shoes to fix your back pain. A mattress store will probably recommend a new mattress. You can clearly see the trend. This brings us back to the chip aisle analogy. How do you choose which specialist to call? None of these options are necessarily 100% wrong, because these may all be viable therapies for your specific episode of pain. But how is it possible that you could receive such diverse recommendations for the same case of back pain? All of these specialists are likely to claim that the root cause of your pain just so happens to be the exact service or product they sell. There are so many options because pain is complex and poorly understood. There does not seem to be a universal consensus on how to treat pain. So any one or any combination of options may or may not work for you. Doing nothing may also work just as well as doing anything. Oddly enough, avoiding therapies altogether, staying physically active, and maintaining a positive outlook tend to work just as well as, if not better than, most treatments. But when selecting your bag or bags of chips, it is important to know that one of these options is extremely unique when compared to all the others. Let's talk about physical activity. Physical activity and exercise can be helpful for short-term pain relief and long-term pain management for three main reasons.